A leaked document from Ontario Health has some disturbing details about wait times at emergency rooms in this province. The numbers are from this past November. In one example, 10% of ER patients who needed to be admitted for care had to wait in the emergency department for more than 2 days before they were moved to a hospital bed. Caryn Lieberman live tonight outside the ER at Michael Garron. Caryn.
Alan, this internal document really gives a snapshot of what it was like for patients who visited their local emergency departments in November across the province. And if you were one of those people, then you know how long a wait it was.
The volumes we were seeing in the emergency departments were at an all-time high. I'm seeing patients, I'm carrying around my computer and going from like one patient to the next, like in the hallway, because there's actually no place for them to go.
Dr. Lisa Solomon paints a grim picture of a day in a Toronto area ER. But based on data revealed in confidential internal health documents, she could be describing an emergency room anywhere in Ontario.
Some of the wait times absolutely are concerning, but some are because they are waiting for a hospital bed to become available.
90% of patients who visited an ER in November spent 12 hours or less there, but 10% of patients were there for even longer, representing an increase from the same month in 2022.
These are the longest waiters, but we're talking about the consistent experience of the longest waiters being the worst in Ontario's 16 past years of history. It's kind of cruel that the most medically complex and the most vulnerable in our society pay the highest price.
In Ontario, the health minister says it's not about pumping money into the system.
This is not a money investment conversation or challenge.
While the NDP opposition points out without investment, you stand to lose more staff.
Nurses, PSWs, others have been very clear that they're not paid properly, that they're not treated with respect. We get big turnover, a lot of burnout.
As for Dr. Solomon, she's taken to apologizing to patients for the lengthy wait times.
It's not my fault, but I feel very badly for them. And I want them to know that, we acknowledge, we recognize that this is the problem. This isn't ideal. We're doing the best that we can do.
And doctors say it is often the sickest people, as you heard there, those with the most complex medical needs who need the most resources in hospital, who tend to bear the brunt of these excruciatingly long wait times. Back to you.